Childhood depressions and what parents need to know. Depressions is the most common mental disorder in the US. When diagnosed, depressions is also highly treatable. Unfortunately, the statistics surrounding depressions in children are staggering. 1.8 million children, or 2.5% in the US, suffer from depressions, and very often, these children go undiagnosed and untreated for lengthy periods of time. Stigma and silence contribute to delayed diagnosis and treatment. It's normal for kids to feel sad, ache, grouchy, or be in a bad mood at times. But when a sad or bad mood lasts for weeks or longer, and when there are other changes in child's behavior, it might be a depression. A therapy can help children who are going through sadness or depression. And there are things parents can do too. Getting the right care can prevent things from getting worse and help a child feel better. Depressions in the very young child. When considering depressions, it is important for parents to understand that there is no cut-off with regard to age. The expert has worked with children as young as 2 or 3 who display symptoms of an adjustment disorder with depressed mood. It is important for parents to pay attention to persistent signs of sadness, withdrawal, irritability, anger, and/or acting out that interfere with everyday activities. Depression is not the same as sadness or grief. Depression is mood disorder that cause sadness and related symptoms to be more intense or last longer than usual after a difficult event. Depressions can also occur without a triggering event. Children may have depressions if their symptoms, which may include sadness, occur every day for more than 2 weeks. Children and teens may not always know how to describe what they are feeling, or may try to avoid talking about it. Older children and teens may try to hide their feeling because they don't want to bother others, for example. However, there are some common signs that of depressions you may notice. Any of these signs can occur in children who are not depressed, but when seen together nearly every day, they are red flags for depressions. So what causes depressions in children? There may be a number of factors behind your child depressions. In many cases, depressions in children often occurs because of several overlapping circumstances. Here are just a few of them. Difficult family events, such as separations or death in the family, can cause depressions in children. Or family history. Children whose parents suffer from depressions are more likely to experience depression themselves and at an earlier age than other children. Children undergoing difficult experiences, for example, bullying or any kind of abuse, sexual, emotional, or physical, are also more likely to experience depressions. So what signs your child is depressed? While sad feelings are not uncommon in children, there may be occasions when your child's blues may actually indicate something more serious. The 2 most common signs of depressions in children and teens. They seem more sad and irritable than usual, in a low mood for most of the day, and they are no longer enjoying activities that used to make them happy. Here are a few warning signs to watch for. Number 1. Never-ending blues. One of the most common signs of depressions in children is an extended duration of feelings of sadness or hopelessness. Before they are able to manage their emotions effectively, most children experience certain situations intensely. It is perfectly normal for your child to feel sad because they did not get to sit next to a particular classmate at lunch, or perhaps because they felt that they had been left out of the game. But children are generally able to quickly overcome such feeling of sorrow and to turn to something else, except if they are suffering from depressions. If your child is still sad because of something minor that happened weeks ago, that might be a symptom of depression. Number 2. Major mood swings. Mood swings are relatively common in children, but they are not normal if they are occurring every day or several times a day, or if they are intense or disproportionate to the event that elicits the shift in mood. These mood swings may manifest as angry outbursts, irritability, crying, general crankiness, extreme clinginess, and any other intense behavior. A team of researchers analyzed the tantrum patterns of 279 3 to 6 years old and found that intense, regular, and disproportionate tantrum behavior manifested more commonly in children who were experiencing clinical issues. Major behavior problems at school may also be an indicator of depressions. Number 3. Signs of withdrawal. Children suffering from depressions are also more likely to display signs of social withdrawal. This may look like keeping away from friends or classmates during social activities. There is no need to worry if your child prefers solitude. Some children need their alone time and appreciate the time they spend removed from others. But if your child seems to be struggling with mood swings and also appears to be socially withdrawn, then depressions may be the cause. Several studies suggest that social withdrawal may be a sign of social or emotional difficulties, and may be your child's way of expressing internalized thoughts and feelings of social anxiety or depressions. Number 4. Major behavior change. Major changes in behavior should always trigger parent concern about their child's mental health. Significant fluctuations to watch for include change in eating or sleeping habits, extreme fatigue, physical change such as headaches that do not seem to go away, among others. Number 5. Thought of death or suicide. Statements made by children related to death or suicide are a red flag for depressions. Diagnosing depression is difficult because not all children exhibit the same symptoms, and your child may react to situational factors differently depending on where they are and with whom. What you need to keep in mind is the fact that significant changes in behavior, as well as persistent and intense feelings that interfere with everyday life, school, extracurricular activities, socializing with friends, etc., are causes for concern. If your child has been showing symptoms of depression for weeks, your family doctor may help you unearth the underlying reasons. To be diagnosed with depressions, a child must have displayed several of these symptoms for at least 2 weeks. So what is practical tips to try at home if you think your child may be depressed? Number 1 is talk and listen. Many children struggle with their emotions because they are unable at this point in their development to understand and effectively deal with difficult situations. Talking to your child about what may be causing them distress is important. Treating their emotions as valid helps them understand that it is okay to have those emotions. Remember that they may not necessarily need the solutions, but rather an outlet to express themselves. Show them that they are safe enough to openly express their emotions. Keep your child active. Ensure that they are getting enough physical exercise every day. Make sure that your child is getting enough sleep. Encourage them to take a rest. quiet time or naps if they need them. Keep track of your child's diet. After all, a healthy body contributes to a healthy mind. Help your child understand that they are capable of success. This may mean encouraging them to participate in age-appropriate chores or activities that you know they are good at and enjoy. Seek professional help if needed. Denying that your child has depressions will not make it disappear. Depressions, even in children, does not go away without treatment. The earlier your child gets the help they need, the easier it will be to tackle their depressions. If you have any doubts about your child's behavior, or if you are feeling overwhelmed, consult your general practitioner or child's pediatricians. They will help you determine the next appropriate steps to take to ensure that your child gets the help they need.